Welcome to our discussion on using the Family Resource Guide to support families. This training is specifically for County BH, but could be applicable for a number of audiences that provide supportive services to families going through the care process. Let's take a look at our agenda today to see what we're going to talk about. So we have two main sections. The focus of the first section is going through those different components of the Family Resource Guide, focusing on how County BH could use that information to support families. And then we'll provide a shorter section, information on self-help centers, which also provides support to families by providing legal information. So some learning objectives today. The goal is that by the end of the session, you will have an increased ability to identify ways in which the Family Resource Guide could be used to support families, establish a trauma-informed approach to family education and support, and then better be able to connect families to support networks. I'm pleased to introduce our speakers today. We're joined by Barry Jacobs and Suzanne Daub. Barry Jacobs is a clinical psychologist and family therapist, and he does a lot of work and presentations related to caregiving to family caregivers, community groups, and medical and mental health professionals. Suzanne Daub is a licensed clinical social worker, and she's had over 30 years of clinical practice and over 25 years of experience integrating physical health and behavioral health. She does technical assistance work to help people understand how to provide that support. With that introduction, I'd like to turn the time over to Suzanne to get us started.
Thank you so much, Patricia. So let's get started with looking at how to use the Family Resource Guide to support families. It's helpful to anchor a discussion in a case, which we're going to introduce here and we'll be applying concepts to throughout this discussion. This is a hypothetical example, so there's no resemblance to anybody that we know in any way. So here we have Mark. Mark is a 43-year-old man diagnosed with schizophrenia spectrum disorder at age 25. He is higher acuity. He has strong family support, but he values independent decision-making. So Mark frequently declines help. He is currently unhoused. He's been living on the street now for 3 years. And his living situation exacerbates his symptoms and makes it difficult for him to maintain medication adherence and attendance to appointments. Mark's mom, Jane, is 68 years old, and her goal is to help Mark stabilize, and eventually she'd like to see him transition into secure housing. And Robert, Mark's father, is 70 years old. He takes Mark food shopping twice a month. He urges Mark to get treatment, but their communication has been deteriorating quite a bit lately. All right, Barry, I'd love to hear you talk some about the importance of family support.
Thank you so much, Suzanne. And Suzanne just described this case, which we're going to be using throughout this presentation to make some of the points that we're making. And so we'd like to start off with just some basic premises before we get into the specifics of the Family Resource Guide. So one, which I imagine that in your work, in your county behavioral health agency, you know firsthand, is that families are very, very important in terms of the support that they provide in terms of the well-being of individuals that have schizophrenia spectrum disorder and other psychotic disorders. So in this case, Mark's parents help him with some of his basic needs, and they provide him with a lot of encouragement. They're encouraging him to use the recommended services and treatments, even though Mark is resistant to using them at this time. We know that family members can assist people, in Mark's situation, very directly by helping coordinate care for them, and that they also help those folks remember some of their own background, kind of what they were like before they had the onset of illness. They also just are very important advocates, advocating for their loved ones to receive the right treatments. So The goal here is that we want family members to be able to work together with participants in the care program or any services that we're providing, but also to work very closely with the mental health agency that the individual is involved with. That's not easy. Family members, as a consequence of trying to support the person in their family with schizophrenia spectrum disorder, often face many challenges. They have to find within themselves a lot of emotional resilience. Frequently, they have to have the financial resources to provide the advocacy and support that they like. And very frequently, they need social support in order to do the best that they can. The point here is, oftentimes when family members do better, then they're able to do more for individuals with schizophrenia, and then those individuals do better. When family members are struggling, then as a consequence, the individuals with serious mental illness may have a harder time. Next slide. So the Family Resource Guide has been produced by a number of constituencies within the state in order to provide some basic guidance to family members about specifically how to work within the CARE Act process to really make a significant difference to their relative. And so it's also something that can be used by county BH staff for trainings and for family members, as well as perhaps for your staff themselves. And it's a very accessible document. It has it's been assessed to have a relatively easy reading level. It's been translated into multiple languages. It provides a lot of information in a very easy to grasp, accessible way, step by step, which we'll go through one step after another. Next slide, please.
Let's dig in at this point. And our hope is that by the time we finish this, you'll have a sense of what you can find in each section of the resource guide. But if you haven't already looked at it, just know that you can find it on the CARE Act Resource Center through the Resource Library dropdown. The full guide is available to you, and it's also available for download. So what we really want to focus on here is how can you, as county behavioral health folks, use that guide to support families? First of all, you can provide the guide to the families. You can either send them to the Resource Center, which is always recommended because they'll get the most up-to-date guide, but you can also just hand them a printed version of it. And it may be something as direct as just saying, we have a really useful tool called the Family Resource Guide that I think you'll find helpful. I can provide you a printed copy of the guide, or there's also a link on the Family Resource Guide to the Family Resource Guide on our county website. For the most up-to-date version, as I mentioned, always go to the website. So the Family Resource Guide can also be used in companion with another tool called the Volunteer Supporter Toolkit, and that goes into more detail about the care process and how volunteer supporters can participate. Consider also integrating this resource guide into any kind of county behavioral health trainings or communications that you have internally, just to improve an overall understanding of the roles of family members and the CARE Act resources available to them. It can be used as a tool to develop your own family supports. So you may look at this and feel like it doesn't quite meet the needs of your population, or there may be specific needs you want to develop out further. You can leverage the guide to do that. And finally, this is a really nice guide to use to help with conversations that are more difficult to navigate. That may be about family roles. It might be about information sharing practices, possible action steps, and things like that. These are all ways that you can begin to leverage this guide. All right, so let's take a look now at each section that we're going to find. This first section really highlights the importance of family in supporting individuals living with schizophrenia spectrum disorder. So this is a huge focus of this. Again, you can encourage families to look at this for yourself, or this can be a way for you to begin to understand the role that families play in the lives of their family members, the ways that they can really be part of your team if they want to be, in supporting their family member and supporting you in doing some of that work. Let's look a little bit now at the second area, the second section of the guide. And this is particularly helpful with supporting conversations with families about their possible roles. So there are the 3 roles that family members can play. They can be petitioners, volunteer supporters, or informal supporters. One of the really nice things about this guide is that it very clearly outlines which of these roles require which actions, where the boundaries are between these roles, and it very clearly communicates to families the ways that they can be involved. Sometimes families feel very helpless and don't know what to do, and this kind of clarity can really help them to discern which really is the best way for us to support our family member. And on the next slide here, we have discussing these different roles with Jane and Robert, who, as you might recall, are Mark's families, is Mark's family. So it goes through the 3 roles: the petitioner, the volunteer supporter, and the informal supporter. And it's just some language for you to use to introduce this to them. And if you want to dig in more, if you want to really use these kinds of scripts to shape your own language or practice what you might say, you might want to just take a look at them on the CARE Act Resource Center. All right, Barry, let's move on and talk a little bit about navigating some of those more difficult conversations, especially about information sharing.
Yeah, thank you, Suzanne. I mean, what we've heard from County BH staff is that one of the main things that come up with their interactions with families is that families express frustration that they can't receive more information about a participant in the care process or any other behavioral health service for that matter, and that county BH teams are often hard pressed to explain this in such a way to families that they understand that there are limitations that are legally mandated to prevent family members from receiving certain information at times. So one of the things that this guide does is it walks through how to have this conversation with family members, how to do it with compassion, really understanding the families are frustrated, but really also spelling out very specifically the limitations that the BH staff have under federal and state law for sharing protected health information. And by providing family members with this information, our hope is that they'd be better able to accept this message when they hear it from you. And we want, at the same time, to encourage family members to share information that they have about a participant in care with you and with the behavioral health team, because they have very important information regarding lots of aspects of their loved one's history, their health background, and lots of information just about who they are, what their personality is like. Next slide, please. The other point of view that we have incorporated into the guide is the importance of trauma and trauma-informed approach within behavioral health care today. So we want the family members to better understand that their individual with schizophrenia spectrum disorder, especially if that individual has been living on the street, experiencing homelessness for some time, that they may have, in fact, experienced trauma, which makes them a lot leerier of interacting with professionals or with anyone for that matter. And so we want family members to understand that the person who they're trying to advocate for and care for may not be someone who readily trusts, readily accepts that help. We also want family members to understand that perhaps in their interactions with their loved one, they too have been traumatized, and they have, and those traumatic experiences have impacted them in certain ways. I can imagine, for instance, some argument that they may have had, some very difficult interaction that they may have had, which have affected them in very emotional ways, and that we're hoping that county BH staff will be able to use the guide to help family members understand this concept of trauma and trauma-informed care, and then also to use the information on trauma to train other BH staff and providers on approaching family members with this trauma-informed approach. So we want to instill trauma-informed care as a basic foundational principle throughout our behavioral health care, including the involvement of family members. Next slide, please. As a part of a trauma-informed approach, we want family members to understand the need for their own self-care. That would be true not just of family members of individuals with schizophrenia spectrum disorder, but with many different types of medical and behavioral health disorders, that family members who are in that caregiver role are under enormous stress, and that stress, particularly over time, takes its toll. And so we want family members to begin to think about and feel okay accepting services for dealing with the trauma that they may have experienced, and to find ways of replenishing themselves so that they can continue to maintain themselves as supports for their loved ones. And so that may be helping them put together some kind of self-care plan, helping them join support groups, to really avail themselves of what community resources and supports exist to really enable them to continue going forward with the support that they're providing for the participant. And they might say something, the BH staff may say something to them like, we understand, Jane and Robert, that supporting Mark is important and rewarding, but it also could be very taxing to you, and over time could really lead to burnout. And considering that burnout may make it much more difficult for you to provide the care for him that you might want, then it may be really important for you to take some time for yourself, to do the things that are replenishing for you, and in that way you'll be better able to help your son than you might otherwise if you're feeling burnt out. And I think coming from county BH staff, that would be a very well-received message, and give families permission to, in fact, take care of themselves and not just the person with schizophrenia spectrum disorder. Next slide, please. The guide also goes through some basic steps to help family members understand how they can be helpful. Many family members want to be helpful, but are not always sure how to help with the CARE Act process or many different types of behavioral health treatment. And so what we've done here is to put together 5 action steps for families that you in your role can share with families to encourage them to play these productive roles. And the first step is for the family members to understand that it's very important for them to develop a good working relationship, what we're calling a collaborative partnership, with their relatives, mental health practitioners. That the mental health practitioners need to be open to that relationship, and families needs to be open to that relationship, and they all need to work together on behalf of the individual with schizophrenia spectrum disorder. So that's the first step. Second is that they have a very important role, as we've been saying, to support their family member with their goals and their recovery. Third, that the interactions that they have with the individual and their family has impact on that individual and on them, and that to improve those interactions, improve the communication and the relationship as best as possible, really fosters recovery over time. Number four is to help family members understand that they need to take the time and devote the energy to really understanding schizophrenia spectrum disorder to whatever degree possible. And we know there's lots of resources out there that we have and that are available online or through or community organizations like NAMI that provide lots of information for people about the normal course of schizophrenia, what to expect, what the treatments are like, etc. And the fifth, as we've been saying in regards to self-care, that that when family members develop a support network for themselves with extended family members, with neighbors, and maybe church or synagogue or mosque fellow congregants, then they can feel that they can better do the job that they want to do. And so again, these 5 action steps are ways to concrete ways to direct family members to make a positive difference in the care process and in other behavioral health programs. Next slide, please. One of the main forms of family support, family network support that we know is available to family members is called family psychoeducation. The best example of this is NAMI's Family to Family program, which you may know is a group of family members of individuals with serious mental illness, oftentimes individuals with schizophrenia spectrum disorder. Those family members get together with a facilitator who teaches them about the disease or multiple, different diseases, teaches them about the treatment process, gives them some tips on making communication within the family more harmonious, less conflictual, teaching them how to interact in a productive fashion and collaborate with the behavioral health team. These groups, usually over an 8 to 12 session period of time, they may occur in weekly or monthly, but they provide a lot of information. They also provide a lot of companionship and support. The people in these groups the family members tend to become close with one another. They provide a lot of support to one another. And so they're both learning about schizophrenia spectrum disorder and other behavioral health disorders, and learning how their experiences may be validated by other people in the group, and they really learn to pull together and feel better supported by one another. Family psychoeducation is an evidence-based intervention, which we would encourage you in your work to recommend to family members in the CARE Act. Next slide, please. And finally, I want to say that there are many resources out there, as we know, for families. There are specific resources for families of individuals with serious mental illness. And so I've mentioned NAMI a couple times. There are also many resources that exist in the world, nationally, and also in California, for caregivers of family members who have other behavioral health disorders and medical disorders. Groups like the Caregiver Action Network or Family Caregiver Alliance, which, by the way, is in San Francisco. That resources also include developing those support networks that we were describing. And we also want to point out and have you point out to family members that the CARE Act Resource Center is a very comprehensive website with lots of recorded webinars and training materials that would provide them with a great deal of education about the schizophrenia spectrum and other psychotic disorders, as well as basic information about the CARE Act and how they can work productively as on behalf of their loved one. I'd like to now turn this over to my colleague, Suzanne.
Thank you so much, Barry. We've been talking a lot here about helping family members connect with meaningful support. And let's just back up and acknowledge that the reason for this, bringing us back to the beginning of our discussion about this guide, is that family members are such an important resource to you guys, to County Behavioral Health, as well as, of course, to their loved one. And this can be a difficult relationship to maintain. The relationship ebbs and flows depending on how everyone in the family system is doing. In a sense, you want to really help family members prepare for running the marathon and to consider how are they going to build their own resilience. Probably one of the most important ways to build resilience is to connect with other people that are in a similar situation so that you not only are not feeling isolated, but that you're also connecting with people who can bring a certain level of understanding, empathy, and lived experience. It helps you feel much less alone, much less shame. I think the other lens to bring to this is the lens of trauma-informed care, which we spoke about earlier. And the big reframe in the trauma-informed movement is to move from asking, what is wrong with you, to what happened to you, right? What happened that caused that trauma? Families often feel like, what is wrong with me? I'm this person's parent, sibling, uncle, grandparent. How is it that I did not provide enough love, nurturing, protection? How is it that they developed this terrible disease? Is it my fault? So I think that helping family members break through that cycle into what's happened here. Our family member has developed a terrible disease. We need to begin to help them and build our own resilience to do that. This also, of course, benefits the whole system because you also, as County Behavioral Health, will then have a reliable partner and not a burned out partner to help you with that. So in helping family members develop support, it's important to really take that perspective and really say to them, like Barry said earlier, this is okay. You really should do that. And it's a good possibility that you will experience a sense of relief and appreciation when you connect with other people that have lived experience as family members with individuals that have schizophrenia, spectrum, and other psychotic disorders. In this case, what's important is know your local groups, know your local resources, and have connections with them so that you can speak about them with both, of course, kindness, but also some authority. Like, I know about this, and I've seen other family members use it. I know that it's great. So what we're going to now look at are just some resources that are available to you. They're linked here, and of course, they're on the website so that you can look at this resource and link directly to them. Barry's mentioned NAMI a couple of times, the psychoeducation program that Barry just mentioned, some of the training resources around supported decision-making. This can also be great for someone in that volunteer supporter supporter role. The psychiatric advance directive could be a really impressive way to begin to connect with families in trying to kind of help them interact with their loved one around what do they want? What's important to them? What matters to them should this happen again? So we really encourage you to take a look at these links. On the next slide, we have a lot of resources to help you understand the care process. The better you understand it, the more comfortable you're going to be in articulating it to family members, but they also can go right to these links to get training to become a really, good supporter of somebody, a volunteer supporter, as well as some of the other roles that are available. All right, so let's just take a moment to summarize. We've just discussed a lot of ways, they're listed here, that behavioral health, county behavioral health, teams can support Mark and his family. Barry, would you like to comment on any of these, or do you have any other ideas that you'd like to offer here?
I think there's some great ideas here that Jane and Robert are looking to the county behavioral health staff to help guide them through what can be a confusing process with care, but also is just a very difficult circumstance in having a child with schizophrenia. And I mean, all the suggestions here on the slide are important ones. I also, if I may, will say that because county BH staff has such an important guidance role, we're hoping that this family resource guide will be of help to families and of help to you in your work, and that in your conversations with some of the family members, that you could actually bring up the guide, look at certain pages together, and have conversations about maybe some topics that were not crystal clear to the family before. Maybe they were unhappy with, for instance, some of the limitations on information that could be communicated with them. But we want the family resource guide to be a way to better help you help them and to collaborate with them. And all these, and that I would add to all the excellent suggestions on the slide for ways that you and your job and your county BH agency can help family members.
Yeah, thanks, Barry. I mean, I think the first two things on this list, right? If you only do those things, I think that is really amazing, right? You know the resources well, so you can have these brainstorming sessions, right? In a sense, what you're communicating is there are solutions here. There are things you can do. You aren't helpless. You're not alone. Let's think about them. Let's look at them together. Families immediately feel a sense of relief and a sense of, wow, there's somebody here to help me. And then validating their experience. There's very little validation that goes on in the world, especially when folks are in crisis or, in a deep sense of grief. And in and of itself, that is such a powerful way. It's a simple way to join with and gain a trusted partnership with a family member, so that as a team, and a family member being included in that sense in the team, can really begin to help somebody like Mark enter into recovery.
I think those are very well made points, Suzanne. I just want to underscore the last one you made about validating the experience of the family, because you mentioned earlier the word shame, and as you pointed out, some family members, unfortunately, in this situation, feel ashamed about that they need guidance or that they need support. Maybe ashamed even that their family member has schizophrenia spectrum disorder. And when you validate their experience, you help alleviate that shame, and you also are demonstrating compassion for them. You're saying, "I kind of get you, and so I'm here for you." And as you're pointing out, that becomes an extremely important basis for a collaborative relationship with them.
Yeah, right. So, there's a lot of other things in this list that take time to really feel like, you can get good at this. Encouraging self-management techniques that you feel like you have something to add to that as well. But my guess is that if you read the guide, you begin to understand these resources and you validate, you're going to have done a huge amount. You're going to have added a huge amount of value to that family's experience. Let's take a look at the self-help centers, Barry. I think that comes next. And I think there's a bit to say here as well.
Yes, thank you, Suzanne. So, I'm sure many of you are already quite familiar with the self-help centers. You probably know that the Judicial Council of the California Courts has created these self-help centers specifically to help individuals with legal forms, with other supports to better enable them to, if need be, represent themselves in court or understand the court process. So the self-help centers are not just for the CARE Act, but for many different types of of court proceedings that affect individuals within the state. And so what do the self-help centers do? And if you could go to the next slide. Thank you. So they provide a lot of services to the public, including understanding how to identify and complete forms to help individuals and family members understand the legal process and what it entails. All those services are offered free of charge, which is, I think, a wonderful benefit. The staff at the self-help centers do not offer legal advice, and that's very important for individuals and family members to know. But they can really just explicate the process that an individual may find themselves in. So they're providing information, but not advice. They may identify additional information that individuals and family members can benefit from in order to be able to go to court and represent themselves as well as they can. The Judicial Council has created about 119 physical locations around the state, which I think is means that there's likely a self-help center or two very close to where your county behavioral health department is physically located. But people who are accessing information from the self-help centers don't just need to go to the location. They can get those services in person, but they also can get them remotely over the phone, via emails, through live chat, and that many locations offer language assistance. So the whole point of these self-help centers is to give people the nuts and bolts of the legal process so that they can really represent themselves the best, and also just understand kind of what's going on, not be lost. Next slide, please. So, one of the things that the Judicial Council has put together for the self-help centers is a self-help guide to the California courts. This is a really very helpful resource. It's online. It has many different things that are part of the self-help guide. It has informational videos and live and video conference workshops. There's form assistance and a list of available referrals. Again, these are all resources that created to help the average individual, average family member best represent themselves within court. When it comes to the CARE Act, for them to understand the CARE Act process, to understand just what role they are playing, what role the court is playing as this unfolds. And then for the last slide, just want to show you a picture of what this self-help guide to the California court looks like on the website. The self-help guide is really tailored to assist those folks that want to represent themselves, and it includes guides which are very concrete, very down to earth, step by step, helping somebody walk through what to do if they're taking legal action, or if they're the subject of legal action. And there is information that they can also contact the Judicial Council directly if they would like some additional information about the self-help guide, if there are aspects of it that they don't understand. So I'd now like to turn this back to Patricia to kind of bring us home.
Thanks, Barry, and thanks, Suzanne, for sharing those ideas about how County BH can really use the Family Resource Guide to in turn support families and help connect them to resources, develop those support networks, and like they mentioned, really take that opportunity to provide some coaching on self-care for the family members themselves. I just wanted to remind you of our learning objectives today. The goal is that by the end of this training, you would have an increased ability to identify the ways in which Family Resource Guide could be used to support families, establish a trauma-informed approach, and connect family members to support networks. Some next steps that we have for you are to look at available trainings on the resource guide, and other topics on the CARE Act Resource Center. Also join our communications listserv to continue to get updates. And we also have a description of different programs that counties provide to support families. If you're interested in receiving that or in being connected with counties that are providing similar programs, you can go ahead and email us at info@careact.org to be connected to those resources. And there is no wrong door. So if you're looking for something, you want help, you need training or technical assistance, and you're not sure where to go, just send us an email. And we can look at connecting you to the right information. So again, thanks to Barry and Suzanne for attending this training, and please let us know if you need assistance.